agent you are using or the drug you are using may handle the case, but it will change the situation to another form. Or at the end of it, the patient experience another challenge, which we call the side effect. But in water, there's no any record that shows that water treatment has side effect. All researches have been carried around, and no one has ever said so, that there is side effect when water is used to treat disease. So it has the buoyancy, and then it can absorb heat fast, and it can also release heat fast. When you are using it for hydrotherapy, it can, gather heat very fast. And when you are releasing it, but the equipment you are using, they can retain heat for a long of time. Even though it's releasing or transferring heat from one body to the other, but it does not get cold quick. And so this hydrotherapy produces some physiological effect the person you are treating. If you assume you are treating somebody that's having leg issues, maybe arthritis, or having head congestion, headache, or having congestion around the chest, there are certain physiological effects that it will produce. And these physiological effects are very, very important. And that's why us to know that in using water for hydrotherapy, you either use in simple treatment. Now, all of us are invited to become intelligent in the use of water to treat disease. So this invitation is offered to all of us. And that's why the next quotation from Ministry of Healing, page 146 says, all gospel workers, how many? Should know how to give the simple treatment that do so much to relieve pain and remove disease. And that's why we are trying to refresh our minds, invited to master to God has provided. His effort will be blessed of God. Amen? So all of us should be co-workers with God. So as a medical missionary, and you know this method of treatment, you are a co-worker of God. When you are to attend to somebody, God is by your side. Well, Jesus Christ is by your side. And to bless you, you take this by faith. Because some will look at it and say, what is there in water that can handle disease? No, it's God that said it. And many have tried it, and they have seen the hand of God upon it. There is power in it. There's power in it. It has saved the lives of so many people, and it has opened so many closed doors. And so we should become competent in the use of water to treat disease. This one, I've read it from script release, page 370. Testimonies, volume 9, page 164. 160 and 64. There are certain points to remember when you are administering hydrotherapy. You don't just rush into the treatment room or on your patients and you begin to treat him. No, there are certain rules and regulations that is good, you must observe if the treatment is to be successful. One is pray first, then explain each step to the patient, then keep the room warm. The room should be what? Warm. Then give the patients water to drink, because as you commence the treatment, he will begin to perspire, sweat. And so you give him water, the one that is losing, so that he will not suffer dehydration at the end of the treatment. He is sweating, he's losing water in the body, so he needs to be rehydrated. You give him water to drink as the treatment continues. So use a cold towel or washcloth to cover his forehead with it, because as you commence the treatment, the body part that is inside the hot water will leave there, and it's hot, moves to the brain, and there it will affect the temperature of the brain. So there's need for the brain to be kept cold. So you now apply the washcloths there, and then if it's congestion around it, to avoid movement of congestion from one part of the body to another, because if you don't observe all these strict rules, at the end of it, you will be confused. You will know what is going on. So be careful not to burn the patients. Some patients are too weak. They are thin and fragile, and some are diabetic. So if you are administering the treatment, know their health status, so that you don't just administer it like that, because some of them, they cannot tolerate too much heat. When it's too much, so that you know that the water you use will not be too hot to burn them. So be careful with teen and children, so they tolerate less heat. Then be careful not to spread infection. So there's cleanliness. It's not just about you jumping. Make sure that if the person that you are treating has a contagious disease, a communicable disease, or you yourself that is attending to somebody, you have catarrh, and you know you have a particular duty to help someone that is sick, then you should make sure you protect yourself very well, protect your patient, use hand gloves, and use nose masks where you are attending to somebody that is suffering from a contagious disease. So where there's hemorrhage, please don't apply fomentations there, or it will, start the bloat again. And then where there are suspected malignancy, don't apply hydrotherapy. Clean equipment after use. The patient should be rested before the treatment. If he is coming from labor, allow him to rest for 10 minutes before you commence the treatment. So avoid giving hydrotherapy immediately after meal or before meal. So if it's after meal, the person should rest 2 hours after eating before you commence. But if it's 15, is coming, I say 1 hour after the treatment before he will eat, then 2 hours after meal before you commence the treatment. Then at the end of the treatment, he should rest for 15 to 1 hour. That depends on the intensity of the treatment. If it's a vigorous treatment, he should rest for 1 hour. But if it's just a mild treatment, let him rest for 15 minutes. So that will now help him, relax very well and make the treatment effective. Don't just ask him to rush or stand up fast, or else, he will fall down there, because sometimes they feel dizzy. Yes, and then as a hydrotherapist, it's good you should know the body functions of the person you're attending to. So all about, because some are hypertensive, some have heart problem, some have, if he's complaining of a particular problem, try and now dig deep into the history of his health. So that will help you know his body functions. And sometimes even during the administration of the hydrotherapy, you take the vital signs. These body functions, we call them vital signs, normal body functions. And so these include the blood pressure, the breathing rate, and then we have the pulse, which is the heartbeat per minute. And then we have the BMI, or body temp, and the body temperature. So for the BP, we know the rate, the normal one, 120/80. The breathing should be 12 to 18 breaths per minute, while the pulse is 60 to 100 beats per minute. Temperature, the average is 98.6 degrees Fahrenheit, while the in centigrade is 37 degrees centigrade. But the BMI is from this information that I use to calculate. There's another information that you use to calculate the BMI. BMI is the body mass index. This one tells us the amount of body fat that is in somebody. The bad fats, the cholesterol that is the body is in the body of the person, and it has some connection with some health problems. The fat is related to some health problems that people are having. And that's why it's good you know the BMI, and BMI is simply the weight divided by the height of the patients in square meter. And so when the BMI is, the weight is 50, this is the instrument we use for the measurement of the height. You just stand on it, barefooted, and then this is the measuring rod. This one is the measuring rod, and then from here that you can so if you stand straight, from here you will know your height. If it's in centimeter, you can divide it by 100. It will give you meter. And then the kilogram, as soon as you stand on it, barefooted, you take the reading. Then you now do the manipulation, you get the BMI. It will help you know if the person will undergo some, lifestyle changes that will help internally reduce the blood cholesterol that is contributing to his health problem. And so these are some of the equipment that as medical missionary we should have. And from here we'll proceed to the practical aspect, because it's more of a practical than theory. I just say this to prepare us for the practical. That's why when you see in front of us here, or beside me here, and in front of you, you see there are some equipment. I brought all this so that time permit will demonstrate some of the procedures here. And we'll see how to apply the hydrotherapy. There are several hydrotherapy procedures. There is the hot foot bath. There is contrast bath and shower. And there is Russian steam bath. There is steam inhalation. And there is ice massage. There is sea bath. There is postural drainage. There is fermentation. All these are the different categories of hydrotherapy. So we are going to pick one now for demonstration. We are going to pick one for demonstration. And we'll start with hot foot bath. Hot foot bath. Now this hot foot bath is a local bath which covers the feet and ankles with temperature generally ranging from 110 degrees Fahrenheit. So the water will cover the feet and ankles. So we call it hot foot bath. It's a type of hydrotherapy. We call it hot foot bath. And so we are going to see a little about it. What are some of the health problems that will require using hydrotherapy? We'll call them indications. They include congestive headache, chest congestion, pelvic congestion, preparation for other treatment, warm the body, to stop nosebleed, aid relaxation and comfort, then common colds. These are some of the problems that if you are experiencing, you can be given this treatment called hot foot bath. And if somebody close to you is having, or somewhere in your evangelism field, you can use this to handle any of the above mentioned health problem. But there are contraindications. Well, this one we call them cautions. In case somebody is having any of this problem, you don't give him this, or you have to do it carefully, like obstructive circulatory disturbances, then diabetes, and then peripheral vascular disease. Where somebody is having any of these health problems, you don't administer hydrotherapy, hot foot bath, the way you can administer to someone who doesn't have this. Most especially in case of hydrotherapy, diabetes, because they are less sensitive to heat. So if you use too much hot water, at the end of the treatment, you will leave them with burns, because they will not know that the water is too hot. And so the purpose of the hot foot bath, purpose and effect is to provide local reflex increase in blood flow through the feet. It improves circulation. As you use the heat, it improves blood circulation all over the body. It expands the blood vessels. And then the person will begin to sweat. And so it increases blood circulation to the entire skin surface, producing the congestion in internal organs, and then brain, and the brain itself. So it relieves congestive headache and chest congestion and pelvic congestion. Hydrotherapy help, this hot foot bath help in relieving all these congestion. So to provide general warming of the body, prepare patient for general application of heat. then to prepare patient for tonic procedures, to produce sweating, then to help prevent or abort cold, then to provide a treatment for local inflammation of the feet. So how is this hot foot bath administered? That's what we are going to see here. What are some of the equipment? The equipment you will need is just, you need a bucket. This one is a bucket. If you use a bucket, but where you don't need a bucket, you can use a basin. This is the basin, or you call it bowl. You can use either of the two to administer the hot food bath. Then beside this, you need a chair. You need a chair. Let's use this. You need this bowl. Then you need a blanket. You need a blanket. The next thing is you need water. You need boiling water. So our boiling water is here. And then you keep it here. You need ice water. You keep it somewhere here. And you need a washcloth. So a washcloth is just like a small towel or a handkerchief size, so bigger than that. So use a small towel. Let's use this for our washcloths. Then the next thing is you arrange all the equipment. Don't leave the equipment scattered. They should be orderly arranged, so that when you need this, you just pick it. And if you are using this equipment, you just pick it. You don't need to rush, leave your patient there, go somewhere looking for something. Then you need drinking water. And this is our drinking water. Keep it very close to you. And so this, my friend, will serve as our patient. So he's the one that I'm going to treat now, administer this hot food bath. And so after doing the consultation, I've consulted him, and I know now I know his health problem. Maybe he's having arthritis. And so I'm going to administer it because it's also good for arthritis. And so you prepare him, encourage him, then you ask him to sit. So you put the hot water inside here. The temperature of the hot water should be around 104 degrees Fahrenheit to a level that he can, or degree that he can tolerate. So you now call him to sit. Sometimes you cover the patient before dipping his legs inside. Sometimes you dip the leg inside before covering. And so now you assist him after the explanation, but before you commence, the first thing that we say in the point to remember is to do what? To pray. So that you commit him to God, commit yourself and the treatment. So that at the end of the treatment, if there is success, even if there's no success, you give glory to whom? To God. Because you that is giving the treatment, you are a co-worker of God, and you need his presence to bless the treatment. So after the prayer, you now explain it to him, assuming it's the first time you are giving the treatment. If that treatment is the first, he needs an explanation. But where it's coming for a follow-up, you are doing it the second time, you don't explain because he is aware of it already. He knows what the treatment is all about. And so you remove your shoes. Then another thing is, when you look at the floor is not healthy for him to place his legs on it. So you need a plastic or a mat or something, a polythene like this. Then spread it on the floor. You spread it on the floor before placing the chair. In case after the treatment he will place his legs, he should be on the mat, not on the floor, because of the heat, the pores of his skin has expanded, opened. So if there's any germ around, it may infect the skin. So, his slipper should be very close, but preferably place a mat so that in case water is dropping, it should drop on it. So now, you pour in water, hot water is there. So you kneel down very close to him. We have said the prayer, and now the treatment is to commence proper. So you hold carry his leg up. You don't allow him to dip in the leg by himself. So you put your right hand or your left hand under his feet as you dip the leg, because the water may be too hot for him. So your hand will help to regulate the heat. So as you dip the leg inside, the leg will go down. If it's too much, if it's too hot, sorry, he will shout or scream. Then you know that it's too hot. Then you add in cold water to dilute it. Then if it's okay for him, dip the leg, then you come to the second one. You dip this one gently, don't rush. Now the two legs are inside. The next thing is you cover him with blanket. So you cover the bowl down with the blanket so that the heat will be accumulated inside. No air will go in. And this place will be tight so that no air, but don't suffocate the patient. So it should be tight so that no air penetrates. So you watch the patients. You watch the person as you administer the treatment. After 10 to 15 minutes, probably maybe he will start sweating. And the next thing you do is but before giving him the water, sometimes they may not need the water. First, when you notice that his body is becoming hot, all you do is you dip this washcloth. This is the washcloth. Dip it inside the ice water that is here. And then you squeeze it. You squeeze. Then use the washcloth to crown him a king. So this one is cold. Make sure you rinse the water very well. Squeeze it out. And no water is dripping. Makes him uncomfortable. So this one will keep the brain cold. And if you want to apply it again, you don't need to you may dip it, or if need be, you just shake it to catch cold and tie it on his head. And the next thing is, this water that is inside here, the temperature will not remain the same. It will be dropping. So what you do is, you have to maintain the temperature. If need be, it should be higher than the starting temperature, because preferable at the end of the treatment, the temperature you are ending with should be higher than the one you are starting with, because the beginning is 103 or 104 degrees Fahrenheit, and the ending is 110. And so because his body has gave you, so this one is the hot water. So you now come very close to where he is. Now what am I going to do now is I'll apply hot water to regulate the heat of the water to maintain the temperature. So come with the kettle or anything that you are using to pour in the hot water. Open it small, shift his leg to one side. Don't just pour in the water like that. So you know what will happen. So he will jump. So you just ask him to shift the leg, or you help him push the legs to one side. Then you come with hot water inside the kettle. Then you pour it gently, using your left hand to stir in the water inside, so that the hot water will be immediately distributed to all the angles of the bowl. So as you pour in, gently, gently. So when you notice that the temperature has increased, then you stop. And next thing, you give him water to do what? To drink. Give him water to drink. Why you are giving him water? Because he's losing water. Already he's sweating inside. He is sweating. And so he is sweating. So you give him water to replace the one that he is losing. And so you continue it that way. As you monitor, do it that way as you observe him, what is happening. You do it for a period of time. You not do it for the whole day. It's not even an hour treatment. It's for some minutes altogether. Preferable 10 to 30 minutes. How many minutes? 10 to 30 minutes. Please, you do it as you check the reaction for the perspiration. So when you are to finish, or when finished with treatment, what you use is to finish or conclude the treatment is hot or cold, cold or ice water. That is the end of the treatment. All you do is you open the bowl, then you come with cold water. That is, if the patient is not having, the person you are treating is not arthritis. But if it is arthritis, don't pour cold water, just leave him to go. Or just finish the treatment. So if it's you are ending the treatment, you come with cold water. Come with cold water, then you prepare the place. You tell him that the treatment is finishing. Bring out one leg, turn the leg up. The toe should be up. Then you pour in. Let me use this. You pour in the cold water. Pour the cold water on the toes. As the water flows down the feet, then you use clean towel. Then a clean towel, dry the leg. Use towel, wipe the feet with it. Place the leg on slippers. Or if there is mud there, just place the leg on it and do the same with the second leg. That's how we end hot foot bath treatment. Then you remove the blanket. You remove the temporary crown, you place on his head. And so, if you have a clean, use a clean towel, probably dip it inside water and give him a cold meeting friction. You can just rub the entire body, the sweat, with a wet towel. Ask him to rest for 15 minutes before you leave. Or sometimes you may give him warm water after resting to take a shower, to wash the body. And so that is hot food bed. That is what we call hot food bed. And so it has helped a lot. Many people that were attended to were having some health issues. Hydrotherapy or hot food, this hot food bed was used and they received healing. And so it's very, very effective. If you try it to somebody, next time you will tell us a story. And many I know have tried it. If I'm to call people, some people now to come out and give us testimonies of how it has helped them in their mission, many will come out. Yes, because it's very, very effective. God has given it to us and so it's working. I've been using it on myself and I've been using it to people around me. In fact, if we are to begin to share the experiences, there are too many. So that is hot food beds. So let's see another one. Let's see another procedure. The next one is, we call it alternate hot and cold treatment. Alternate hot and cold. This alternate hot and cold is another important hydrotherapy. The alternate hot and cold, they are also of different kinds, because you can use alternate cold and hot in hot food bed. You can use alternate hot and cold. You can also use it in seized bed. You can use alternate hot and cold in seized bed. Even in shower, you can use alternate hot and cold. It's not necessary, in hot food bed, because the most popular one is the hot food bed, where you see, so just the way he's sitting down, you can decide to give him hot food bed using hot and cold. And let me just explain this one, because it's very close to hot food bed. The alternate hot and cold is you use the hot and cold at the same time. So this one is the cold and this one is the hot. So he will dip his leg inside the hot and then remove it after some minutes and put it inside the cold after some seconds. The equipments are almost the same. The difference is that you add a second bowl for dipping the legs. So you add a second bowl, and that is the difference. So you use the hot and cold. The minutes for this one is 4 minutes for the hot. Then the cold one is 30 seconds or 1 minute. And this one produces a lot of effects that are very, very important. Alternate contraction and dilation of blood vessels. Marked increase of blood flow locally and reflexively. Increases metabolism and oxidation. It hastens healing. We need it for impaired venous circulation, indolent ulcers, infection, sprains, strains, fractures, arthritis, congestive headaches, and edema. When somebody is having cancer or malignancy, please don't administer this treatment to him. When somebody is having malignancy, I say, or cancer, or a tumor, so advisable to apply this. And where somebody is diabetic, you have to be careful when, as you administer the treatment. And so, the cold water that you start with, the temperature should be around 45 to 70 degree Fahrenheit, while this one should be around 110. So you dip the leg inside this one for 4 minutes. You cover him with blanket, please. You cover him with blanket, then dip the legs inside this one for 30 or 1 minute. And then you'll be doing it like that interchangeably. You'll be changing. So you do the same thing with, as you did in the hydrotherapy. If you notice that he's getting warm, apply the wash clothes. If you notice that he's dehydrated, he's sweating, give him water to drink. As the temperature of this one is dropping because he's removing his legs here, put here, now apply the hot water inside here to maintain the temperature. And this one too, the temperature will be increasing. So you have ice water there, very close. You'll be dropping it so that the temperature will not rise. So you maintain the coldness of the water and the hotness of this water by the application of hot, and cold water after some minutes. So the changing may be around 4 to 6 times. Dipping the leg inside the hot water 4 times, and then dipping the leg inside cold water 4 times. Sometimes may be more than that, depending on the reactions. So you do that to make sure that the required result is achieved. And so already he is covered with blanket. And so when you are ending, there are 2 ways of ending. You may end it with the legs inside hot water, or you end it with the leg in cold water. So if he's ending in the inside hot water, so you don't dip the leg inside cold water. All you will do is just get in the cold water, pour on the toes, and then you dry the legs. But if he's ending with hot water, you don't do that. In the case of arthritis, you just end it that way. And let him dry the legs with towel and uncover him, give him cold meaty friction around the body to dry the body. Allow him to rest. Allow him to rest. After resting for 15 minutes, if he's vigorous, let it be up to 1 hour. Then after the resting, can ask him to go and lie down. So all these treatment you can administer to the person sitting down or lying down. If it is too weak to sit down, you can't administer it for him with him sitting, because he may not be able to sit. So ask him, get a mat, let him lie down on the floor, and then his legs cough. Dip it inside the water. You will be the one to do everything for him because he's too weak. So then you use a blanket to cover him while his legs are inside the water. In the case of somebody that is too weak to, carry it himself, so you can administer it with him lying on the mat. So these are the 2 procedures that live able to cover, can be able to cover now. Because of time constraint, we wish to stop here. I believe the little we have learned or have refreshed our memories will help us as we leave this place. So I will go and use this to help those who are sick, that in our homes, in our immediate community, or anywhere God may call us to evangelize, so that it will minister healing to so many people. And from there, maybe if they are not our members, they will open up and will share the word of God with them. The purpose is not just for us to heal them physically, but when we treat them, that's in the case of those that are not our members. That will help, unlocking their hearts, open up, and when they open up, now cheapen the word of God to them. So with this, say that may God bless all that we have learned. How many of us have enjoyed this hydrotherapy treatment procedures? And how many of us would like to know more? Please, there are a lot